Hello, everyone. Happy Friday. Thank you for joining us today. It's 1 p.m. Central Daylight Saving Time here in Winnipeg, and it's a great sunny day that I'm observing from inside my house. Um, we're here to share some updates, some cool things, some tips, as always, during these sessions on Friday. Together in a different order today. We have our amazing team of account managers. Top left is Mike, top right is Noel, bottom left is James, and bottom right is Jay. We're going to talk about some interesting things this week, and I hope it's going to be informative as always. Feel free to share the stream with your connections and on social media to get the information to as many people in the industry as we can. And yeah, let's move to the first topic. Where our first topic today is something that we've been experiencing and kind of learning as we go and speak with all of our clients during this time. And it's about where are you at on a spectrum of just sitting on the side observing and seeing how the situation evolves, and on the other spectrum, just buying everything and subscribing to everything and following all of the advices of all of the dozens of webinars that you've seen. Let's call it the two extremes. Where are you at? And we're going to talk about few approaches, and today it's going to be interesting because we're going to have Mike and James kind of double team this topic. Why don't we start with you, Mike, and kick it off?
Thanks, Alex. Yeah, so starting off the topic, I myself, I've heard of 6 offices that have already filed for bankruptcy. With this being said, office production is down across the board for all offices in all provinces, while that overhead is still in full effect. So that's something that I really wanted to touch base on and to note on this webcast. One thing that I really want to bring light to is just reviewing your account payable and see what payments should be put on hold or what payments should be assessed at that point. That way, it'll, as you're not having that production, you're not producing that amount that is typically used to pay for all these things. Some examples that I can bring to you guys would be such as your bank and equipment loans, such as contacting them to only pay that interest instead of paying that full amount for the time, just because you don't have that production coming forward, as well as another route that you can look at for moving in that direction would be contacting your landlord regarding your rent situation and how you can possibly create, say, like a payment plan for that. That way you can continue to hold down that spot as you don't have that production going. James, did you have anything that you wanted to add on to that?
Yeah, I do. Sorry, I got distracted there for a sec. For my point is, over the last few webcasts, we've spoken on a lot of different topics. One that I've been focusing on over the last few have been things like rediscovering yourselves and your practice and your purpose as we're going through this, the values and the commitment to best practice methods going forward, your office and your team goals, visions for the future and what that looks like. And last week specifically, we spoke on the COVID toolkit and how technology can help. This week's topic, I want to go based on Mike's point there and talk about assessing your clinic's position, what the office looks like currently, what it's going to look like in the short interim, and then what your future goals are going to be. I've had numerous discussions with offices, admin staff, doctors over the last month and a half. And in my discussions with everybody, it's really been broken down into kind of 3 groups of people, I noticed. One is offices who are cutting all of their expenses in efforts to curb any sort of financial impact, as Mike was describing beforehand, and minimizing everywhere that they can. Even off of that topic, a few offices have just decided that that they're not going to take on any clients until the whole threat is over altogether. So there's different modes of thinking. The second group is the ones and the offices that are all about exploring their current setup and exploring what it's like to go more digital and to be more secure as you go digital, because that is what they feel ultimately the system is going to go to in the next few years as it is. So taking the downtime now, and as we spoke about, it's very hard to get this in a normal world where you can take a week off or 2 weeks off and really think about that. Most normally when you're taking vacation, it's due to not thinking about the office. And then we have the third group, who's kind of like that middle of the road group that's waiting out and kind of riding the storm and proceeding with changes as needed or has been doled out by the regulating bodies and colleges. And in retrospect to these conversations, all three are ultimately okay based on your respective positions on it. And what I mean is if you're cutting expenses, that's okay because we know that the financial impact is real. If you're all about exploring things right now as well, you know that the timing is real. And for the people who are kind of waiting out the storm as well, they're again just waiting to see what changes are going to be made or what recommendations are going to come so they can make that movement and either proceed to go more digital or to scale back on operations for expense and financial reasons, right? But the world, ultimately, it's going to change, and the changes are a question that we're asking our offices all the time, or what changes are you going to make moving forward, right? And you'll notice this in the conversations that we'll be having and that we've already been having, because some offices we still, like for myself, I can speak, there's still a few where I've left messages and we've obviously sent some email information packages, but I still have not been contacted back. So it's a matter of we're following up on timelines as to when reopenings are going to be and what those action plans look like. But there's a lot of things you have to think about, especially assessing your clinic's current position, current versus future. That's a major talking point and a plan that you should be really exploring right now, because again, the risk that you run sometimes by kind of being stagnant on decisions are a lot of these things get off put for long periods of time. I can name one example just with IMAs and security altogether. Those seem to be things that, yeah, I'll do that in a couple of weeks or down the road, and for whatever reason they don't get done. And then in the end, if an impact happens, now that's just another part of the risk assessment that wasn't fully done, and now you're liable for that, right? So you want to minimize any liability. Are you speaking with your accountants to review any lists of expenses right now and what makes sense to cut and what makes sense to put on hold? Are there any grants or anything that's been given that can help supplement that income for the time being? And the timing of much needed upgrades to go digital, as it seems to be, that's the way that everything's going. Are you exploring all of those options as well too? And when I say that, that's not a sales push in any sense that we want to promote something, as much as it's really, if you look at your office dynamics and you just break it down into even one area, just touch points in your office, you start seeing how there are technological things that are out there that can help relieve those touch points for you. And that's really where I'm going with the conversation, is making sure that you're exploring those options and you're having those conversations with yourself, with your staff, your ownership group, because ultimately you want to have one common goal, and that is your health and the health of your patients that are coming in. At the end of the day, we're all humans. We all have to go home as well to our families and wives and husbands. And we want to make sure that you are working and you are giving yourself the most safest place that you can possibly give. Another question is, are you creating any sort of action plan based on phases that make sense? right? Because right now, the two main phases that you should really be looking at is what's going to financially make sense and what's going to make sense for patients. And also in the patient aspect is how can we go through overturning patients in a profitable way as well for the next little while, to make sure that the flow of the patients that are coming in, their safety, the forms that they need to fill out, all those things are all within an action plan that is going to give you the best chance to come out on top throughout all of this. And have you assessed all, like I mentioned before, all the touch points in the office and had communication with your account managers for your respective softwares that you're with on what technology is available to help minimize those, like I mentioned earlier? Patient communications, again, that should be a big part of your action plan, because again, right now there's several items that not only the software can do for you to help, but the software is there to really give you the best edge on safety. And questions you should be asking are what ways are you getting your messages out right now? Are you still doing paper, cards, mail, phone, email, text? And if you're using the newer end with the email and text, do you have mobile numbers for everybody? Do you have an email on file for everybody as well, so you can make sure that one way or another that they're connected with the procedures that the office is going to be making throughout the changes? And have they've been effective so far? Like, what is your response? Do you have a plan to now, when every single person comes in, even though they may not want to be communicated by email for their appointments, are you grabbing an email on file just to say, hey, listen, when the important stuff comes out, or any forms or consent things, when we have a patient portal channel to securely send this through, we would need an email to send this through. Can we just get that on file? And again, by doing those simple little key things, it's going to bring you a lot more success, and you're going to minimize the fact of someone walking in saying, hey, I wasn't really communicated about that. I just wanted to walk in as I was in the area. Are your consent and COVID forms loaded into your software right now? Is that part of your action plan? And it very well should be. You want to make sure all your medical forms are up to date and everything that is being regulated and asked of you to give to the patients are there. Again, you don't want to find yourself liable for anything at the end, or risking anyone's health. And have you had any issues with patients not completing those forms or sending in those forms before they enter the office? Right? Is that a pushback on other appointments? Is your admin staff going to be now tied up on phone saying, I'm really sorry, Mrs. Jones, thank you very much for sending in the form, but I need you to recomplete the form because there's these 4 questions that still haven't been answered. Like, all these things are all things that you need to consider when you're making these action plans. And again, these are, like I said, just questions that we're going to be asking offices as we go forward. And it's not really to dig in to find as much out as we want. It's to find out if there's any areas that we can help in that maybe is a good idea that may haven't been thought through by a full group, or only one person has the idea, but it's a great idea, but they don't want to speak up about it. Those things. We want to make sure that we kind of go down over a checklist with you. And what I would like to do here in the next week or so is kind of send out a video with the help of the other AMs that are present today, to go over a quick checklist with you and to ask these questions and to make sure that everyone's on the same page and we all have a consistent plan going forward so we can all be successful. One other part of the conversation that I just lastly want to touch base on is, what are your plans for PPE right now? Now, I know in Alberta, through one of the regulatory bodies in one of the documents, there's been several. So forgive me for not knowing exactly which one, but I know it was mentioned that you want to be ordering your PPP in 2-week intervals. And I've had a few conversations with offices all across the region so far. And one thing, like, I was talking to an office yesterday and they said, no, that everything is, like, for Alberta is being doled out by the ADA. They're all ordering as such, and then kind of picking up those supplies on the 2-week basis that they need. But one question that has been asked to me was what are other offices kind of doing? And it's not for any information sharing, but I have had conversations with other offices where they're trying to gobble up everything that they can right now, to make sure that they have some sort of stockpile so they can be protected and secured just in case. But the other end of that conversation at the end of the day is making sure that it's feasible for everybody right now to get the supplies that they need. The last thing that the system would need is shortages of any sort. So you want to make sure that you're following your guidelines and that you're ordering your PPE effectively and through the right channels to make sure that A, it meets all standards and guidelines, and B, to minimize any shortages on supplies as well. So like I said, those are some key questions, some key points that we've kind of gone over as a group, that we've had conversations with offices. We want to make sure that all of you have a chance to kind of hear the conversations that we have, because A, it's informative, and B, if it keys in on a few ideas that's going to make life easier for you, that's exactly what we're here for. So that's pretty much what I have from me this week.
Awesome stuff, guys. Thank you very, very much for that detailed outline of these things. I think you guys have hit the nail on the head, or I guess two nails. Each of you had a nail. It's very interesting to see the different financial positions that clinics are in and how that affects their decision-making process, and their entire plan, if they even started coming up with one, with regards to how to tackle, the reopening, and whether to even reopen right now or later. So I think those are very good questions that needs answers. So before we go to our next topic, we have a question from Patricia, who is a vivid viewer of our stream. We thank you very much for joining us every Friday, and we thank you for your questions. So Patricia is asking about the healthcare workers that cannot work in more than one location at this time. And is this the same what's expected for temp hygienists and assistants? The real answer to it is you have to ask your regulator. From what I know and information that I've gathered in across the provinces, I know it's not necessarily directed to all health-related employees. It's more so to the staff that are working in the hospitals that have exposure to the virus and higher risk. Also, it is true in some provinces for care home workers with regards to their inability to work in more than one care home at the same time. Now, having said that, if you are working in an area or thinking of working in an area that is higher in regards to people who contract the COVID-19 and you feel right away you're at a higher risk, then you can make a claim to your employer that the that the workplace is not safe. There's a process that I discussed with our friends at Rudner Law with regards to how the employer needs to behave and what options are to employees if they feel their workplace is unsafe. It's a webinar that we have a recording on that I did with them on Wednesday. So that's with regards to that. I haven't read any provincial health authority guidelines that incorporate that limitation to people who work in the dental industry as of yet. So, but if I urge you, if this is a question that is extremely important in your situation, I highly recommend that you go and ask your regulator to make sure that you're getting the proper answer. Also, you can ask your provincial health authority, give them a call and give them your situation, and they will give you the latest with regards to their recommendation and guidelines or limitations. So I think that's also very important to note that you should be able to speak with actually the regulators. And although we do also speak with regulators and read a lot of material and interact with a lot of offices, so we do have a lot of information that is across the country. Having said that, whether it's our webinar or someone else's webinar, I urge you to speak to the actual regulators who set the guidelines and regulations, and that would be probably the best place to seek actual advice. And then, if there's something legal, obviously seek legal advice. And if you're seeking legal advice, ask 2 lawyers and not just one, because they only give you the recommendation based on their experience. That's also the case when you're asking advice from government establishments. So whether it's employment standards or CRA, always call twice. And the same goes with public health and your own regulator. Unless when you call your regulator, you get the same person, then it might be a little awkward. So I hope we answered as much as best as we can, Patricia. Anyone who's viewing, feel free to post a question through the chat on the stream. We'd be more than happy to answer if we can. If we can't, we'll hopefully direct you in the right direction. We're gonna hop on our second topic, which has been kind of going around for quite some time now, and a lot of controversial and conflicting information going through. And Jay's going to touch base on some elements and some items with regards to air purification within your clinic, and what we should look for and what questions to ask.
All right, perfect. Thank you, Alex. So before jumping into that air purifier, or like whether what are the myth or the things that are bothering us, before we jump in and put our money into that, is like the discussion that we had earlier, that what type or where do you sit in that category, just like what James had mentioned earlier, right? That not lead to the like worst financial situation before you invest in these PPEs, as we know that there's a shortage of. Like now a lot of it actually not just in the dental industry, right, but across the country there's a shortage of PPEs now. Now you would think that, okay, well, I can get my hands on these now, this is available, so I'm just gonna invest my money here. So now, well, is it worth it? Like when we now talk about air purifier, because it is quite pricey, right? For something that like I've heard, because even in my own home, like I was not really a fan of air purifiers when that became a fad at one point where everybody needs an air purifier, right? But then you don't know the scientific studies and behind that, does it really work, right? So now, in this situation that we're in, as we always talk about, that we would want to provide a safe and healthy environment for our patients, right? So now, for you to get, I'm getting different like versions of inputs, various inputs of whether I'm just going to get a regular air purifier or like the UV air purifier, which is for some people there are thoughts where it might be harmful. Well, anything that is like we all know that any huge amount of exposure to UV light is it would cause damage to to human skins, to animals, and even plants, right? So in the just to break that myth, though, like the ones that you get, they're actually safe, but make sure that just like what Alex mentioned earlier, that we're not your authorized people to say, oh, because they said so, right? But make sure you do your due diligence and research about these things, and ask your manufacturer, because another thing to consider when getting these products is the ozone, right? There are a lot of things that that would cause the what do you call this? The damage to our ozone when we're talking about UV, because that's interrelated. But then with these ones, like you can get, they're actually protected in a like inside the when the air comes in, it's actually inside of a like a metal metal box, which lessens that exposure. And what's in it, like, so later on, do you still ask, is it safe? The two officers I spoke with, they prefer that over the regular air purifier, aside from them factoring in that, okay, no, this is really safe. But then another thing is cost, because it can range from like 1,500 to like maybe $2,000, $3,000, $4,000. And with this one, they say that it's more, it's like it's a well, not really plug and play, but it's less of a maintenance, because the cheaper ones you get, which is good as well, like it is HEPA, it is HEPA filter, it has HEPA filters. And but yet you have to maintain like every 2 months, 3 months, and get these accessories for maintenance, right? Like, which would cost you hundreds of dollars, and later on the cost would just be more than what you would get for a UV air purifier. But yeah, for if you're being offered these products, at the end of the day, there's no scientific claim that it kills the coronavirus that is out there. But then what we know is that it reduces the concentrations, and it reduces the potential exposure, right, of these pathogens. And that itself would give you peace of mind, for not just for your staff, but for your clinic. And just to segue on that, it is very important that when we communicate, I know it was touched on earlier, when you communicate with your patients, it is important that you communicate not just your time, or that you guys are open for emergency and for urgent treatments, but also what are you doing in place of in this particular situation, because we want the patients to be convinced, and we want them not to feel afraid that, okay, well, is it safe to be in this environment, right? So talking about the patient communication, I think Noel would be talking more about that. So yeah, that's it for me. You can see the link and read more about it. I found a lot of interesting stuff. It was, I think, shown earlier in the screen. All right, thank you.
No problem. I didn't show it on the screen, though I put the link to an interesting article, although from a company that sells those, but I found the article very informative and written in layman terms, just to share some information with regards to the questions that you should ask yourself when you're looking at air purification, specifically, the UV light. And there are a few questions. There's first, what is the wavelength of the UV light in the device that you're looking at? Things like, is it incorporated into your HVAC unit, or is it something that is a standalone unit? Then aspects as, like you said, through the purification process, and I think it's called germicide eradication process, you create ozone, and what is the amount of ozone that's created, and how is it too much where it's toxic to human, or is it not too much? Is your device you're looking at might be ozone free? There are devices like that. And if you're looking at medical grade devices, which you should be, then obviously looking at a Health Canada certified device is extremely important, and that's kind of the first place where you start to make sure that, yeah, it's Health Canada certified. Now let's go and put a check on all the other boxes that we want. But it's important to ask the questions. And I know that there's a guy, he's a doctor, that basically created a UV light air purification system on a different wavelength. So instead of UVC, it's called FUV. It's a fast UV, which I'm assuming it's it's just a fancy name, but it's a different wavelength that's supposed to be very safe for humans, because I know there's some concerns with regards to continuous exposure to a UV light can be cancerous in some cases, or even hurt your eyes. So with regards to this, I only seen one research with regards to the fast UV light air purification, and that research was done by the person who invented it. So, I'm probably going to wait for an additional research to come out for that. Um, but in general terms, you're right. This needs to be explored with regards to, does it make sense to our clinic and our setup and our budget and our plan for the space we want to create for our staff and patients, and all of that needs to be investigated really thoroughly with regards to research and competitors and pricing and everything. So definitely something to look into. And even if it does not kill the COVID-19 virus, it kills other bacteria and viruses that are present at places that deal with medical services. So it might not be a bad idea anyways, if especially that patients have been exposed to articles and CDC and global claiming that dentists and assistants and hygienists are the highest risk for all the disease and everything. So that just showing the patients that you've taken extra precautions and you've done all of these things to make sure that staff and patients are safe, that will go a long way, and it will help with reestablishing trust with the patients with regards to getting back to the new normal. So lots of if you had lots of things to consider, you might want to add this. And then now we're going to go to our next topic that Noel's going to cover with regards to let's take some action and communicate with your patients, because we've been repeatedly saying communicate to your patients every single week, probably at least 20 times throughout our broadcast. But now we want to take action on it, and you might not know what to say or how to say it or how to send it. And these things, Noel is going to take the lead on that and give you the lowdown on that.
Thank you, Alex, and hello, everybody. And again, thanks for tuning in. And it's very crucial to relay the information to your patients. And how would you communicate? Sure, you can send them an email, you can send them a text, or even a phone calls. But what if you have hundreds of them? That's very difficult. Now, we sent an email earlier to a non-client or Maxident clients and non-clients about the e-blast services. Normally, during the normal days, the e-blast service is at cost, but during the COVID-19 pandemic, Maxident offered the service as a complimentary. This is one way of helping the offices to relay the important information, updates to their patients. Now, what is an e-blast? An e-blast is short for email blast. And my opinion, this is an effective and efficient way of sending emails to many recipients. Now, what do we need to send email or broadcast or e-blast the updates information to your patients? Now, we do require a letter, of course, containing the information or updates about your clinic. And if you do have a logo, we can incorporate that as well. And the next thing is, of course, the email list, the email addresses. And for Maxident clients, we do help them extract the emails from the Maxident database. Now, what if you don't have any emails? Well, we do have if you have the mobile numbers for your patients, we do offer the SMS blast as well. And again, that is a complimentary service. And Thanks for tuning in, and that's it for me this week. Thank you.
Awesome, Noel. Thank you very much. So yeah, we all have to do our part in helping out. So definitely opening up that service at no cost to our industry, whether you're our client or not. We'll do the heavy lifting for you, just because that's not your forte. You should be dealing with helping patients with their oral health. We're here to help you on everything else technology. So definitely take advantage of that. And I really like the fact that you mentioned if you have a logo, then we'll incorporate that, which goes exactly up my alley for what I want to say next. So, if you joined us last week, we announced that we are now able to help offices with their graphic design needs. I'm happy that a few have already reached out to us and have requested some items, specifically logos. And what I wanted to share is that if you are watching our stream here, I want to be able to offer you and your clinic the ability to design a logo if you don't have one, or redesign your logo if you have it and you're not in love with it. See if our team in the background are able to create something for you. We'll do that at no cost. Obviously, not to the hundreds of thousands of people across Canada, but let's start with the first five that reach out. We would gladly create a logo for you and your business and help you create that branding uh, around your business for your patients and for your community. And for you as a business owner, I think it's very important to have a logo that incorporates everything that you believe in. So I think that's important to me, and I feel it's something that's important and needs to be done. And if you thought it's too expensive or you didn't have enough time to deal with this, we also can do the heavy lifting here. And worst case scenario, you didn't like any of them. Uh, we'll just keep throwing them your way until there's something you like, or until we quit and you say, you know what, you have the best one. Um, just as something to help offices deal with their day to day. So just another something we do for the industry, and I think it's important to share and help whenever you can. So the next topic I want to talk about, and I put it in exclamation mark just because, well, I control these scrolling texts. So is data backup. So every week, and we touched upon this last week, but I want to touch upon it again because every week we are seeing offices that are having problem with their backup. They're having problem with their data, whether it's ransomware, whether it's data is missing or data is corrupt or there's something wrong with that. And I want to use this opportunity and tell our viewers to please, you can treat it as homework or whatnot, please go back and check your backup. What is being backed up? Who is backing it up? And when was the last time that we restored it to make sure that the data is usable? You can also use this exercise as an understanding of how long will it take your service provider to restore your data. So in a case of a disaster, you will be able to know how long it would take you to get the data back. And you can incorporate that into your disaster recovery plan, which if you do not have one, you should use this time to create one because disasters happen all the time, whether it's floods, fires, electricity surges, uh, theft, ransomware, all of these things, they happen. They don't just exist in that policy for just in case. These things happen, and because we work throughout the country, we know they happen more often than we would like. So please, please, please go and check your backup. Um, I will not talk about backup anymore on this stream, but please, please do. Um, so the last topic I want to talk about is data analysis. So when you have some downtime, like you have right now, and you want to take your mind away from anything COVID related. What I want you to do is I want you to look at your data. And if you're not sure as to what it is that you need to look for and what questions to ask, then I urge you to reach out to us and we will help you. Um, what we want to do is we want to offer you a data analysis, the ability to analyze in depth your data, because data never lies. We want to help you analyze where are the points in your office that would require attention. So you're able to plan out what needs to be done with regards to training your staff, with regards to generating reports, making calls, reaching out, and changing even processes within your clinic to be a little bit closer to best practices. So all of these things, all of these conclusions and information, intelligence you can deduct from your current data. Now, whether you're a Maxident user or not, we're still offering that. We would love to help you get an understanding of your patient base and the data and starting being in control of it instead of just being something, somewhere in a hard drive in a server room back, um, in the back area of your office. This is a very important and precious asset that you have as a clinic, and it's only precious if you understand it and you can leverage it to provide better patient care and better, business decisions, operational decisions with regards to how you run your practice to the best effect. So we would be offering that complimentary as well, just because we want to have our clients and their teams engaged and thinking about, we already theoretically already hit rock bottom, hopefully, fingers crossed, because we've been closed, we've been doing nothing for weeks now. And now we're at the bottom. Now it's the time to take actionable steps and understand and build our plan of how we climb back up. And yes, we don't have all the answers, and we won't have them in 2 weeks either. But there are things that are universal. Patients are going to need dental care. How much layers of PPE you're going to be wearing is not going to change the fact that humans need 2 professional cleanings. Average humans need 2 professional cleanings per year to reduce chances of oral cancer and oral disease. It's not going to change that. So you have to work with the things that you know while you research and verify the things that you do not. And the things you know is the data, and we are the data specialists, and we can help you figure out and make heads and tails of what the data means and what are the important things that you can change within your practice to be better in all aspects. So we want to be there and help you with that. Feel free to reach out to us. It's not a quick and easy process. It's an in-depth analysis, so it's going to take us a few weeks while we figure out the data and we create a report that we'll go over with regards to what are our findings and what are our recommendations. So that is basically what the service is. And if you would like, we will also recommend how to tackle these things and which one to tackle first to get the best impact on your clinic. So definitely all of those things are included. So good stuff. So I think that is all we have for you today. You guys, do you have anything to add over what we've covered thus far? Awesome. So that's good. So again, thank you everyone for joining us this Friday. I wish you a great weekend ahead. And we will see you here next Friday. Feel free to share our channel here. This is where we're going to be presenting all the time. If you have yet to subscribe to it, please do. You will get notifications when we go live, so you can quickly join. And if you want to talk about anything that is related to what's going on today or what you want to happen tomorrow, feel free to reach out to us. We're always here, we're working, and we look forward to hearing from you. So until That happens on Friday. Thank you very much, and we will talk to you soon.